Hello and welcome. The world's largest vaccination drive is rolling out tomorrow in India, and it is going to roll out across the country simultaneously with some focus on community and primary healthcare centers and hospitals, big and small. Now, there are many aspects to this vaccine rollout. There are many questions, and hence this show, which is a special dedicated call-in show for you to ask your questions about what this vaccine can indeed do. To answer those questions, we have Dr. Vineeta Bal, faculty at the Indian Institute of Science, Education and Research in Pune. She is a former scientist with the National Institute of Immunology. She is an immunologist who has worked on infectious diseases epidemiology in the past. Dr. Bal, thank you very much for joining us. But before we start off with you, I'd also like to bring in my colleague Sadhika Tiwari, who is at a center which is going to start administering the viruses tomorrow. The center is somewhat special because it's in the Prime Minister's constituency in Varanasi. And Sadhika joins us there from the Women's District Hospital. Sadhika, very good evening to you. So what are you seeing?
So basically, we are at the Women's District Hospital, and this sort of is at the center of the city, and it's under special focus. Also, I mean, the preparations here are better than all the other centers, which are 6 centers in total in the district, because Prime Minister Modi is going to do a live conference here and interact with all the beneficiaries who are getting vaccinated. This center is going to be vaccinating 100 people in 4 slots of 25 people each. So I'll just take you through the center. This is what it looks like, Govind. This screen that we see right there is going to be the screen from where Prime Minister Modi is going to interact live to the beneficiaries who will be sitting here. There are 25 chairs that we see. So as people enter from here, this is the registration desk where they will have to get their data verified on the sitting here to take the data on this app. And this is the vaccination room where beneficiaries are going to be vaccinated. This is what it looks like. This place is going to have a vaccinator, a primary vaccinator, and a co-vaccinator, their assistant. Before, right after the vaccination room is the observation room. So there are 3 observation rooms. This is the first observation room. The next 2 rooms are also here. 10 people are going to be sitting here. And for 30 minutes, the beneficiaries are supposed to keep sitting here after they get vaccinated, just in case some sort of adverse effects of the vaccine sort of come up. And after this is the last room. This is the AEFI room, Adverse Effect Following Immunization Management room. This room has beds and here's all the gear. There's syringes. There's the sort of everything that can sort of go wrong after the vaccine. So this is to prepare for that. And this that we see.
Right, that's very useful and insightful, Sadhika. So who is going to get vaccinated tomorrow? I mean, is it going to be frontline workers, health workers only, or others as well?
So tomorrow it's going to be just frontline health workers. Although there's a little less clarity on this, so the CMO of the district says, I mean, technically also the PIB really said that the first phase is going to be frontline workers, including health workers and policemen. But probably tomorrow, because it's the sort of first day, it's just going to be health workers and it's going to be class 4 staff. That's what I've heard.
And are you getting a sense that the people are keen to get vaccinated, or is there hesitancy or concern, or what's the general mood like?
So I feel like, I mean, the people that I've spoken with so far actually don't know what is the process, what is going to be. Also, these are class 4 sort of workers. So it doesn't seem like they have a say in whether or not they want to get vaccinated, and they don't know which vaccine are they working with, what is it going to be like. So I mean, people are clearly apprehensive, but I also feel like there's not enough information that they have to sort of make a sort of opinion.
Right, and since we don't know who they are, and should we assume then these are people who've been selected through the process? I mean, either it's those who are part of the database of health workers.
I could not hear that, Govind. Can you repeat that?
Right, Sadhika, no, my question was, should we assume then that these are the people who are going to get vaccinated tomorrow have been selected from a database of health workers or a local database of health workers?
Exactly. Yeah. So basically, on this app, over the last 15 days or so, all the departments were sort of asked to create this database,
Right.
and it's sort of an alphabetical order. So the 100 people who are going to be vaccinated tomorrow were picked from that database.
Right. Sadhika, thank you very much for that, and look forward to your next round of reports from Varanasi.
Thank you.
Right. So, Dr. Bal, thank you once again for joining us. So let me start off with, I mean, we've got a lot of questions that have already come in and more that will. So let me start off with the first one, which is, we've got two vaccines that are being given out. There is the Indian one from Bharat Biotech and the Indian collaboration one from Serum Institute. Now, those who are receiving it do not know which one they are receiving. So what should people do? Should they just take the vaccine as it is given? Should they even ask? Can they ask?
They theoretically should be able to ask and say yes or no. But I don't know what will be the practical reality, because Covishield, which is by Serum Institute, that has received emergency approval after showing that it is effective in protecting individuals. The Covaxin, which is by Bharat Biotech in collaboration with ICMR, still is undergoing phase 3 trials for which there are no results, in the sense that we do not know what is the efficacy of that vaccine. So I do feel that this is unethical to give Covaxin, which is the Bharat Biotech manufactured vaccine at this stage. In fact, in theory, I would have liked to see only Serum Institute manufactured vaccine to be given to health workers and to everybody until we have clear results of the Covaxin.
Right. Okay. So anyway, so that process is now underway. So let me ask you the more, let's say the medical question or the medical scientific question. How long will this vaccine work, at least theoretically? I mean, do we need booster shots? Now, we have to remember that only people over the age of 18 are being given vaccines. And historically, of course, only children are given vaccines. And therefore, this is a new thing for most adults, or something that they're encountering after obviously many, many decades. So the question to you, Dr. Bal, is how do I know how long it's going to hold and what will be its efficacy?
So efficacy we would know at a population level when the vaccines complete their phase 3 trials. So that is the efficacy 60%. If that is 60%, that means out of 100 vaccinated individuals, only 60 will be protected. If it is 90%, then 90 out of 100 would be protected. That's how we tend to interpret it. But what we do not know so far, because we are still in the midst of the pandemic, is that how long these vaccines, which are supposed to be effective, how long will they provide protection? Because everything about the phase 3 clinical trial is hurried. And in that sense, while we know vaccines are safe enough, after the booster shot, the vaccinees are followed up only for 30-35 days, especially for the emergency approval. So we don't know whether these vaccines will provide protection for 1 year, 2 years, 5 years, no idea. The first vaccine which was approved, the mRNA-based vaccine, some preliminary data on that, because the trial started much earlier, we know that maybe at least for 6-8 months, that vaccine is giving protection. About the others, we will come to know as we go along.
Okay, so that was a question from Anne Crasto on, how will the government keep track of who has taken the vaccine or not? The other question from her is, how will I know if someone has taken the vaccine?
That this will be possible to check only by doing a laboratory test. The laboratory test should be primarily for the presence of antibodies directed against the viral components. So those will tell me that I have actually been vaccinated and I have mounted an immune response. That still doesn't necessarily mean that I know I'm 100% protected. But whether I had a vaccine or not can be tested. Unfortunately, these laboratory tests for antibody detection, are not commercially available easily across the country. So you may have to seek special labs and so on to see if you yourself are vaccinated and have mounted a response or not.
Okay, Lyall on Instagram asked us, what would life after being vaccinated look like?
Well, if individually, it will not look different. And I don't think even globally, in the next few months, it will really look different. People may have psychological relief if they themselves have been vaccinated, assuming that they are protected now. But the vaccine doses available today are so few that so-called large-scale vaccination for every adult human being, or even for children, say, is unlikely to take place at least for another year or so. So that is what everyone should be careful about. And as I said, even if I have been vaccinated, if the vaccine happens to be only 50% efficacious or 60% efficacious, do I fall into the vaccine responding group or vaccine non-responding group is another consideration. So keeping all this in mind, the mask and the physical distancing that we have been following for the last many months will have to be continued, I think.
Right. Okay. So here's another question and related. Abhishek Anand asked us again on Instagram, I'm considering getting vaccinated only after a large crowd gets vaccinated to see if it's really harmless. I need to be on the safe side. Are there chances that vaccinated people will infect me with the virus in that period?
Vaccinated people, because of the vaccine, will not infect you in anybody, because vaccine is either consisting of simply the proteins of the virus which are introduced into the body, or the killed virus being introduced into the body. So that does not result in transmission from the vaccinated individual to another individual. If such person gets infected despite vaccine, that's another story. But the question was also about safety. And if you really look at the data that we have from phase 1 and phase 2 trials for most of these emergency approved vaccines, acute, meaning short-term consequences, hazardous consequences have been really minimal. What one would call as adverse events or side effects, those have been minimal. And based the earlier vaccines that your person who has asked this question might have taken vaccines, those were also tested in similar fashion for very common side effects which are noticeable in the short period. So these vaccines, all of them, are likely to be as safe as the other vaccines that we talk of. The question is about efficacy. And that is the response that I gave you earlier. We don't know enough about the duration of efficacy.
Right. Okay. And I'm going to come back to the efficacy part in a minute. Here's another question from Harsh Trivedi from Los Angeles. He says, I live in LA and will have access to the Pfizer vaccine, which is claimed to be about 95% effective. Is the vaccine made in India equally effective? Theoretically, everyone across the globe should be vaccinated with a vaccine with the same efficacy and safety so we can travel to all countries without worrying. Correct? Question mark.
Well, yes and no. All vaccines have different kind of efficacy. So the one that he is talking about has 90-95% efficacy. The serum produced vaccine that is getting rolled out, the Covishield, has around 60-65% efficacy. We do not know about the Covaxin. So that is not such a big issue, because whenever I mount an immune response to a vaccine, if I get vaccinated, I'm likely to produce antibodies and the so-called T cells. So between Los Angeles and between Bombay or Pune or Delhi, wherever the person wants to travel, that in itself is not going to be the critical determinant at all, because he will get vaccinated, he will be protected if he gets vaccinated, because it's 95% efficacious. And in that sense, he is unlikely to get infected and or spread the infection, because he can't get infected. So individually, he should consider himself safe enough, especially if he tests for antibodies after his vaccination. And that vaccination that he's talking about is mRNA vaccination in all probability. Okay. Yes, he mentioned Pfizer. Correct. Yes.
Right. Yeah. So here's another question from Arundhati in Mumbai. She says, what about vaccines for the elderly? Will they be given at home or will they have to go to hospitals?
I wish there was a possibility and we had infrastructure, then the individuals should be vaccinated at home. But there are two problems with it. One, there isn't enough manpower and infrastructure that we have. So these visits will be very hard. As we have seen, even for the follow-up, we could not do follow-up very efficiently. The second point is, in case the reactions to vaccines are not very common, but in case there are adverse reactions, somebody is feeling faint or something, then vaccinating at home will have its own risk. The Varanasi center that was shown earlier did show that there was one room with 5 beds along with other equipment which was there. That was the emergency situation in case it arises. So I would recommend that whoever can actually reach a hospital or a place properly set up for vaccination, that is the way to go about rather than waiting at home. Should not take vaccine at home if you can help it.
Right. So let me ask you the other question then. Who can, or in what situation could you experience an adverse reaction?
That is very difficult to generalize, but some individuals are quite allergic. They are allergic to certain drugs like sulfur drugs or some other drugs. Some people are very allergic to peanuts or other food, right, and so on. So generally, people who are very heavily allergic are likely to be allergic to some component or the other of the vaccine as well. But in general, as I said, the safety issue has been dealt with. And these kinds of serious adverse events, as one would like to call, they are quite few. So there is no way of predicting. But what people in the UK were told was that if you are always carrying adrenaline because you are very susceptible to one kind or the other of allergy, then don't go for vaccination. That is all the generalization I can make, but that's an extreme case. No, such people should probably not go very close until we know on a large scale that such adverse effects are even rarer than we think they are.
But either way, you're saying that if I have allergies and or maybe certain kinds of comorbidities, and I'm obviously going to ask you what they are, I should not be venturing out right now, or I should wait for longer. Is that correct?
You are making more a black and white statement, and I'm making a gray color of it, because there is in between. So it is not like 100% yes or 100% no. But there are always benefits with an effective vaccine. And so one has to do the cost benefit analysis. That is why if you ask me questions about comorbidities, I'm going to say that yes, you should take a calculated risk, and that calculated risk can be determined with the help of the physician that you can consult. So are you really at a high risk, or are you okay with the risk, is something that your doctor should be able to give you broad guidance at least.
Okay, so now there are two vaccines. What if I got one of one and one of the other? I mean, either by mistake or maybe I want to try my luck in some strange way. What would happen?
The luck is not necessarily going to be a contributor to this. I would, because this hasn't been tried. So what we go by is tried and tested approaches rather than mythical situations or anything of this kind. So both these vaccines, to say 2 vaccines are available, they have been proven safe and effective with 2 doses of the same vaccine, not with crisscross immunization. So to be on the safer side, I would say stick to whatever you had as a first dose, go back to the same vaccine, same dose. But if you really say that, oh, there is desperation and there is second vaccine is not available, so can I take this versus that? I don't think such an emergency is likely to arise in the current Indian situation, because we are not in the phase of the pandemic that we were in September. The cases have gone down. So that kind of emergency is not there any longer in our country. If somebody in the US says this, or Britain has recommended it, saying that, okay, take whichever shot you can, but complete the shots, I won't easily say that, because it does not have enough data to say, yes, without any problems, you can take one followed by the second, and you will be as well vaccinated or as well protected as any other. So it's a cautious interpretation of the question that you said.
Okay. Rohan Agarwal from Bhopal asks, India is inoculating frontline workers and older people first. Indonesia is inoculating young people first so that they can go out and work. And this was a view expressed by some people in India. I was interviewing Kiran Mazumdar Shaw of Biocon, and she said the same thing a couple of months ago. Now, Rohan Agarwal says, while young people are less at risk themselves, they could be super spreaders, and shouldn't our vaccine strategy keep this in mind? So let me flip that a little bit and ask you, Dr. Bal, if I'm in a family where there are obviously older people and I have siblings or younger people or children, who should we send out first, assuming we had the option?
If you had a choice. I think currently the vaccination policies are determined by the availability of the vaccine doses and of course affordability. So that if it is possible that all 4 or 5 people in the community, in the household, can get vaccinated with whatever price the vaccine has, then everybody should get vaccinated. That's the best option. But if not, then it's also peculiar in the sense that I agree that if young people get vaccinated and if they mount immune response, they will not spread it to everybody. But the vulnerability is also an issue. So it is really a balancing act. People with comorbidities like diabetes or hypertension are also somewhat at a younger age, they are somewhat less well than those without these comorbidities. So in a sense, protecting them is useful because if they fall ill, the chances of their getting severe disease are much higher. So it can happen in the house. Of course, it can happen in the house that young person who goes out, comes back and spreads the infection. But these are the risks that we live with. There is no simple solution.
Right. Okay. The other next question is from Salva, who's from Mumbai. Salva asks, should children be vaccinated against COVID if the vaccine comes into the market? Now, obviously, the vaccination, as we know, is focusing on frontline workers, older people, but because children obviously could transmit the virus far more effectively and efficiently.
Sure. I think, again, I will go back to the availability of data. So when initial clinical trials were started, they were strictly done on young adults who were healthy without any comorbidities and so on and so forth. As the vaccination trial numbers increased, then people have started including those above 60 years of age or 80 years of age with more comorbidities, and also decreasing the age from 16 years to 12 years to 8 years. So slowly the data are emerging. And in principle, as an immunologist, I do not see major risk in vaccinating, say, school-going kids. But again, the information that we have so far says that children are not really suffering too much if they get infected and fall ill. So again, this will be a balancing act. But eventually, when more doses become available and more data become available, even kids could be vaccinated. My guess is that by that time, ideally, we should actually check who has antibodies already infected without them knowing. And that might solve the problem, but it's not that easy. Easier said than done.
Right. Is there any situation today? I mean, and you refer to that as well, Dr. Bal, that cases are down quite sharply in India. We are at less than around 15,000 cases now. The number of deaths also have fallen quite dramatically. So could there be a situation where someone could self-assess and say, okay, I don't need to take this vaccine, either because I've already maybe contracted COVID once, or I feel that I'm in an environment where my exposure to the virus is very low, or the potential for exposure is very low?
Yeah, all these options are theoretically possible. But somebody, for example, who was infected, either was hospitalized or was not serious enough to be hospitalized but had what we call as asymptomatic infection, at the moment they do not need a vaccine dose at all, in my judgment, because they have recovered. That means they already have an immune response developed against the vaccine. And by now we know that at least for 10-11 months, since it's about a year since the pandemic started, we know that at least for 10-11 months, the vaccine, the infection-based immunity is likely to last at least that much. We don't know whether it will last for 5 years, but at least for about a year, it is lasting. So in such a situation, people who were already infected and recovered need not take vaccines. But people who didn't even know that they were infected, as I said earlier, there is what is described as an antibody test. For that test, if that test comes positive, that means without your knowing, you were infected. Even
Right.
such people, in principle, need not take vaccines at all. Not in the near
Right.
future, for another 6 months. Those who are antibody negative and those who definitely did not have infection, those are the ones who should consider more seriously getting vaccine shots in the near future as and when available.
Right. Last couple of questions. We've heard of new mutations from United Kingdom, South Africa. Now, will the vaccine be equally effective against these new mutations and for newer mutations which may surely emerge in coming days and months?
Yes, this is a debatable issue, but my personal opinion is so far the vaccine, the mutations that we have seen in this virus, including one in UK, another one in South Africa, and some other countries, those mutations are not so drastic that existing immune response. For example, say if I was infected, I have developed immune response. If I get infected with one of these mutant strains of the virus, my antibodies they are likely they will give me protection. Similarly, the vaccine which if I take shots today, that vaccine or those vaccines, currently available vaccines, all of them are likely to be adequate in providing protection against these mutant strains. However, the mutations go on accumulating, and there might be a day, maybe 6 months later, maybe 1 year later, we don't know how much how much in the future. But at some point, it may be the case that the vaccine induced immune response in individuals is suboptimal as far as the protection against such mutant strains, new strains of the virus are concerned. At that time, we may have to, we meaning companies may have to modify their mRNA and make new vaccines. What strategies will be used is all speculation right now because we did various things for the vaccines in an emergency situation.
But so vaccines, therefore, are also evolving. I mean, maybe let's say the first so many millions of doses have been released, but it's possible that the next batch or the batch after that will have something in response to potential mutants.
So not the next batch or the next batch, but what will have to be done is that if it is discovered that there are really new mutants which are not showing any or other vaccine is not protective against such mutants, then people will have to take it seriously, see where the mutation in the virus is, and make that an appropriate mRNA and start vaccination. So it is a process which is to be initiated from practically very beginning. What I don't know is that whether such a vaccine would need to go through again phase 1, 2, 3, or only phase 3 will be sufficient, or there will be no trials. This is something that the scientific community, epidemiologists, immunologists all over the country, all over the world, including WHO, need to evolve as a strategy. We will have to think about it, but this today is too early to think about.
Right. Last question, Dr. Bal. So, we are going to finish, depending where you are in the world, about a year of this pandemic. In India, maybe a couple more months. Now, in the journey to come back to normalcy of some sort, or the way we knew life before COVID-19, where are we, in your estimation?
In India, I think that the vaccines will be available on a large scale and large number of people will get vaccinated during 2021. And also what is happening is that many of us are already infected, and you must have heard about the so-called sero surveys. Some of the sero surveys showed even starting from July, August, that 50% individuals were infected. Those sero surveys need to be repeated. And if we find that 70-80% of the individuals are actually infected because of a variety of reasons, then it will seem as if we don't need to take so much precaution. But what is important is, for example, flu virus or some other respiratory viruses are floating around and they keep infecting small number of people, what we call as endemic disease. Currently, we are in the epidemic, which is large scale infection. Endemic is low level continuous infection. So from epidemic stage, we are moving towards endemic stage, and that low level infection would persist. But because it is low level, and of course, as you know, the COVID-19 is not such a major killer as Ebola virus infections are. So all in all, I feel by 2022, we would be pretty much back to normal. Whether wearing masks in public places would remain in fashion or not, I don't know. But we have also seen on the screen from Singapore that for avoiding pollution, people, or in China, people keep wearing masks. So are we going to adopt that strategy for the rest of our life? I don't know. We might have to simply get designer masks and live life like that, I suppose.
And that will be good for all of us. Dr. Bal, we've run out of time completely. Thank you so much for joining us and providing all your answers and insights to the many questions that have come up.
Thank you very much.